First of all, I would like to say that being here is a dream. And so many times I found myself at home, late at night, studying scientific articles by people who are here today. And I have the privilege to share in the stage with. So thank you, Lord, for this gift. I'm Dr. Juliana Tenorio. I'm a plastic surgeon specializing in lipedema. And today, I'm excited to share with you an innovative approach that extends beyond surgery. It's about empowering women, restore self-esteem, and enhancing quality of life. So, we often discuss the physical pain and struggles associated with lipedema. But it's crucial to understand that it's about much more than just physical aspect. It's just about emotional well-being. That's how women perceive their bodies. And for years, I felt frustrated because I couldn't fully help my patients. Their pain, struggle, and insecurity were something I encountered every day, but I lacked the knowledge to change that. Then I had the opportunity to hear directly from Stefan Rapisch in Germany, and that experience changed everything. I realized that lipedema surgery could more than just volume reduction. It could restore confidence, mobility, and quality of life. I discovered that my patients want more than just reduction. They desire not merely thinner legs without contour, but they prefer medium volume with clear definitions. Which surgeon here has performed a significant surgery here that remove a lot of fat, but the patient was not happy in the final? And perhaps the answer lies in the fact that it's not only about reconstructive surgery. Aesthetics are involved too. When we treat lipedema, we are addressing women's health, which includes their perception. And sometimes we forget that women with lipedema have muscles, which often remain hidden due to their struggle with muscle hypertrophy, or because there is a significant amount of fat counseling them. The fact is, we need to help rebuild their legs and give them hope to feel beautiful, attractive, and confident enough to wear any clothes without facing judgment eyes. My focus begins in the preoperative phase, addressing inflammation, adjusting lifestyle, and managing clinical and hormonal aspects. This way, I control lipedema before surgery and increase the chance of the surgery having better results. And for these pre- and post-operative care efforts, I named LIP8. And the final step from LIP8 is surgery, that I call Lipedema Definition Technique. And this approach is extracted by two reasons. And the first is demonstrate to surgeons that it's possible to not only remove fat, but also create contour. It's not enough to simply remove a large amount of fat. Patients desire legs they may have never had before. And the second, this technique is reproducible, meaning that any surgery another around the world can adopt it. Beyond that fat reduction, we use advanced lipedema techniques including infiltration and tumescent infiltration and pole liposuction, while considering muscular contour with a systematic marking of 12 points. So, how do I do it? For each point, I have a specific objective. The entire leg will undergo liposuction, but each area will be treated differently rather than applying a uniform thickness of fat through the leg. I propose considering two factors, the patient's complaints and the second, the muscle grouping. And there are the 12 points. The point 1 is a medial tight, and my objective here is remove volume from the medial part of the tight and enhancing mobility, and maybe it's better for the compartmental syndrome of the femoral, I don't know. The point 2, here the main part is the knee. It's the part that most patients feel embarrassed out. The knee marking seeks to define one of the most affected and stigmatizing regions of lipedema. And my objective here is reducing accumulation of medial, lateral, and superior fat in the knee and marking the quadriceps. Point 3, it's the lateral one, and I will reduce the lateral fat pad and mark the lateral tight in reference to the iliotibial tract. The point 4, carefully remove fat to avoid increased sagging and to maintain the contour of the leg. At the point 5, anatomical knowledge indicates that tibias in women without lipedema are more pronounced. Point 6, remove fat, but a certain volume is maintained to preserve the contour. Point 7, addressing ankle reduction is crucial. So I asked my patient to turn the side while I finalize markings 2 and 3. When the patient is facing backward, I start marking from the bottom up. And point 8, marking the ankles are made to ensure proper fat removal. Point 9, that involves fat reduction and marking the gastrocnemius calves. Point 10, I also mark the posterior tight. And it's important to be careful with excessive liposuction to avoid increase the patient sagging. And the point 11, it's the gluteal region. I will remodeling the gluteals involving liposuction with the inframedial fat pad to reduce this excess fat in this area. When there is accumulation of fat in the inframedial part of the butt, the shape can appear scared. Point 12, back shape liposuction is vital. It addresses the fat pad in the lumbosacral region, which is a significant indicator of lipedema. The Lipedema Definition Technique respects anatomical and muscular contours, improving the definition and contour of the treated area. This technique is based on a systematic marking process that encompasses all areas in the leg, ensuring that each area will liposuction with a specific objective in mind. And my goal is to achieve a balance of fat removal while minimizing consequences such as sagging and loss of shape, ensuring that the final appearance remains natural and aesthetic pleasure. Here's the same patient on her pre-operative and the second photo on her first day post-operation. And the results have shown significant improvements in both subjective and objective measures, enhance the quality of life of my patients at all stages. And this is stage 1. This photo illustrates a common complaint among patients regarding the knee. With this technique, we can achieve a knee that is aesthetic pleasant and free from stigma. This is preoperative, lateral, and the pre and post-operation of stage 1. Post-operation after 1 month. Another patient, stage 1, focus on knee, pre and post-operative in the first day. It's the stage 2. This is another complete case showing the preoperative and post-operative procedure. The markings, lateral, pre and intraoperative. This. Let me show, sorry. This is another patient. Before. Okay, let me, sorry. The last case, not here, it's okay. It's a complete case of this woman. He's the disabled woman who wants, it's a complete case from start to finish, involve a 27-year-old woman who was depressed and she was avoiding using clothes. A preoperative and post-operative. Post-operative of her. Lateral. And I deeply appreciate Joanna's article about depression and other conditions associated with distress of lipedema. I recognize how real is it, lipedema causes emotional problems, and these issues can exacerbate the condition, leading to a difficult, vicious cycle. And here's the same woman who once felt sad, buying clothes to hide her legs. Now, with her permission, I share what his photo represents to me. It's much more than just the fine legs. It's the smile on her face and the joy radiating from her. And I think when you treat lipedema, we are not just changing bodies, we are changing lives. And it's possible to transform lives of this woman. The Lipedema Definition Technique is not merely aesthetic. It's about self-esteem and the quality of life. Thank you.